Plant-based diets do not cause risk of severe hyperkalemia, that's high potassium, in people with kidney disease. Thanks for watching. This video is about plant-based diets and kidney disease. And this piece of research comes from May 7th, 2020. It was published in the Internal Emergency Medical Journal. And what they did was they looked at people who had plant-based diets. They actually switched people over to a plant-based diet and seeing how their potassium levels were with kidney disease. And for the most part, what we worried about with plant-based diets and kidney disease is that too much potassium, okay? Too much potassium is not good for you. And that's always been the reason that we told people don't eat too many vegetables, don't eat high potassium foods, don't eat fruits, a lot of fruits with kidney disease, where all those recommendations have changed in the last couple of years because it shows so much benefit. And this study showed that you didn't really have to worry too much about potassium. And that's what we've been looking at over the years, is that we're focusing less and less on potassium, finding that plant-based diets have so much benefit in kidney disease. A plant-based diet over a diet that has animal proteins like chicken, fish, eggs, beef, anything animal-based, dairy products, you have less acid buildup, okay? So that's a lot less acid that your kidney has to deal with. The phosphorus, you absorb much more phosphorus from animal-based products, whereas opposed to the phosphorus that's in plant-based products is only absorbed a little bit, a lot less, so phosphorus levels can be controlled well. Plant-based proteins are easier, there's less metabolic toxins. All right, they also referenced in this study that the plant-based diets help with constipation, a common problem in CKD. It also helps with gut dysbiosis, that's all the buildup of the bad toxins and all those kidney toxins that goes on in your gut. And it helps also with just easier processing for the whole body, helps cholesterol too. So many benefits that come from a plant-based diet. And like I mentioned, we've been moving over to plant-based diets. It's a new recommendations. It's even recommended by most of the kidney foundations. And for anybody that's wondering if they should or shouldn't, you can always do the before and after blood work to see how your numbers are. You can always do a 60-day test, 90-day test. So the good thing about diets is they're not set in stone. You could always change it right away. But it's something you should consider if you have kidney disease, switching over to a plant-based diet. Now, one of the issues is that potassium that they worry about. Now, what they did mention in this study was that people had some type of nutrition education training. So if you're going to do a plant-based diet, get some books, check out some more videos, look at our website on plant-based diets for kidney disease at healthykidneyinc.com, because you need to learn a little bit to switch over. Now, one technique to lower potassium, if you're going to go plant-based and you're worried about it, is something called leaching, where whatever food you had, let's say you had some high potassium vegetables, maybe potatoes, you can soak them in water for a couple hours, and that helps take out some of the potassium. And then you boil that food for a couple minutes. If you want to boil it fully to cook it, that's fine, but you can boil it for a few minutes. Dump the water out, take your food, and then use another cooking method, and that also helps lower potassium. So if you're worried, you can try leaching the potassium out of your vegetables, so very beneficial. But if you're considering a plant-based diet, it's really good for the kidneys. If you're on one now, you're doing great. And when I say plant-based, we're really talking about getting out the animal products and putting in legumes, pulses, lentils, nuts and seeds. These are going to be the major sources. Soy products, if you're eating soy products, that's another plant-based food that's shown some benefit in kidney disease. So these are the type of things you'll be doing. Very beneficial, something to consider if you're not on a plant-based diet. Bye.